and welcome to Smiles by Mary. I'm Pat Dewar. Today we're going to be talking about Invisalign. It's a special kind of new braces that are semi-invisible. And the host of the show is Dr. Mary Swift. Dr. Mary Swift is the 2011, 2012, and 2013 Consumer Choice Award winner for cosmetic dentistry in the city of Dallas. Now, she recently got a special award, and I'm going to have her begin to explain that. Dr. Mary, thanks so much for being on the show again.
My pleasure. Thank you, Patrick.
Angie's List.
Angie's List. Excuse me, Angie's List Super Service Award.
Super
We're
Service
very
Award.
proud of that.
Now, that's a real exclusive thing, isn't it? It's by invitation only, so to speak.
My understanding is it's a nomination by consumers.
Right.
So it's an honor.
Well, you've got a track record of massive success. Your history has been in creating a lot of smiles for your clients for some time now. Today, and as always, this show is really about helping your clients and potential clients learn more about the different services and so that they can make a good decision whether they use you or even go elsewhere. But the idea is, hopefully, the attractor factor's on. So, Invisalign.
Invisalign. Invisalign, what it is a series of clear trays that move your teeth into a corrected position. It creates a beautiful smile without having to suffer through the wires and the braces traditionally.
Now, when you think about that, a lot of people may not know what those look like. I think of what I put in my tray, my mouth for whitening.
Patrick is actually doing Invisalign, and so he knows firsthand and can give the viewers, the consumers' perspective on it. The trays are thin, lightweight. They're made out of a nickel titanium material that has some memory built into it, and each tray moves the teeth a little bit. 2 weeks you switch to a different tray, moves a little more. Very easy to do, very comfortable, and has changed my practice completely. And by that I mean I can be a more conservative dentist. I can remove less tooth enamel if I can move things into place and get alignment correct. I can have fewer restorations, fewer crowns, fillings, bridges, implants, the expensive stuff, less of that if everything is lined up and healthy to begin with.
That's a huge difference, isn't it? Because in the old days, like even my son years ago, he had regular, wired, and they had to pull out several teeth, and then they'd been moving stuff around. It's been taking years.
Yes.
But typically, Invisalign doesn't take that long comparatively, does it?
Invisalign was developed by orthodontists who recognized originally people that had braces as a teenager and then saw their teeth get more crowded as they got older. Old school, we used to say, wear your retainers for 6 months and then at night and then you're done. We know now from experience that teeth will crowd whether you had braces or not as we age. So even if you had them lined up as a teenager and saw how perfect they could be and then watched them move as you got older, that's a great Invisalign patient. And that's what the product was originally designed for. The product, the company, Align Technologies, they put a lot of money and time into research and development, and now we can tackle a multitude of orthodontic alignment issues with Invisalign.
Wow. I know that one of the other things is that if you want to see more information on this, you can go to Dallas Laser.
Our website has
Right.
lots of good information about Invisalign, and Invisalign, the company, has some very good information also.
Well, I know that you guys have actually put a ton of video. We've done other shows on that, but the idea is really helping you understand that the Invisalign process, how simple it is, and then how effective.
Yes, simple, yes. Not quicker. That's one of the common questions I get is it faster than traditional braces? No. teeth should only move at a certain speed, and if you speed it up too much, you can not do a good job, basically. So not quicker, but invisible, easy to wear, easy to use, shouldn't interrupt your lifestyle at all. You can attest to that.
Well,
Yes.
it's actually great. I mean, one of those things that you just don't have to worry about it. And I know that as the time goes by, so much of it is just going to begin to show up.
Yeah, and if we could touch on who it's good for.
Yeah, I was going to ask that. Who should be doing this?
Anybody that wants a prettier smile in general. But what I see the biggest benefit in my practice with Invisalign is anyone that's getting ready to have dental work done, make sure everything's in the best position possible before you start having implants placed or bridges or fillings or any, that foundation, that alignment, any work that's done, any money you spend on your teeth will be spent better if the alignment is correct. Kind of like the foundation on a house. Make sure the foundation is good before you make the improvements on top.
Absolutely. I know as we're here with Dr. Mary Swift, 2011, 2012, 2013 Consumer Choice Award winner for cosmetic dentistry, and Smiles by Mary has more for you. We'll be right back.
Staying involved in dentistry on every level, local, state, and national, makes me a better dentist. Our patients are our life and our livelihood, and we appreciate every single patient that walks in that door. And these are our family, and we treat them that way.
And welcome back to Smiles by Mary. I'm Pat Dewar. The host of the show is Dr. Mary Swift. We're talking about Invisalign, which is a special kind of bracing braces that you would insert into your mouth, and they're invisible to most people and comfortable for the folks that are wearing, aren't they, Dr. Mary?
That's what they tell me. And I had it, I wore Invisalign personally too, and it was just so easy and comfortable.
I know one time I heard you say that some people actually lose weight on these things.
Yes, it's the Invisalign diet. You're wearing the trays, and for Invisalign to be effective, you have to wear the trays. 22 out of 24 hours a day is what is recommended. So you take them out to eat, you take them out to clean, but if they're not in your mouth, they're not going to move your teeth. And so you start looking at snacking a little differently. Do I really want to take that tray out just to have a bite of something? So we say there's an average of about 5 pounds lost.
That's good.
And I joke with my patients and I say my cuticles never looked so good because I can't, you got these trays in, you can't. It's so easy to do, and it's one of the most asked for procedures in my practice. And as we talked about before the break, people who had braces at one time and saw how straight their teeth could be, those are the ones that are really wanting to get back in alignment. But as we talked about before the break, there's been some advances, and Invisalign now conquers even more complex cases than just a little minor crowding. One of the biggest applications in my practice for Invisalign is pre-restorative. In other words, before we start fixing the teeth, we get them into the best place possible. Alignment all the way down the spine starts here. Joint, if you think of a hinge in a joint, all of that has to be aligned all the way down. So if you've got healthy teeth alignment, you literally are going to live longer. There is research that indicates that the more teeth you have as you get older, the longer you live. Digestion and nutrition starts with chewing, and you want that function to be healthy the whole way through your life, and it's going to stay healthier if it has all of the alignment checks and balances that have to do with proper occlusion.
That's cool. So what I'm hearing is that folks that are looking at, maybe they want to get veneers, or they have a tooth that they need to replace and they have an implant.
Especially veneers, Patrick. I have, I can't name names, but a patient who had veneers done at another practice. and they kept coming off, and they kept chipping, and they kept breaking. And so she's in my chair going, what is going on? And it was basically the restorative dentist didn't kind of consider the position of the teeth before putting the pretty veneers on top. And if teeth clang and bang each other in the wrong way, those veneers and porcelains they're gonna pop right off. So that's, as I was alluding to before the break, if you get everything in proper alignment first, like improving the foundation on your home, before you make those cosmetic aesthetic improvements, that's money better spent. You're gonna get a better outcome with fewer repairs if you have everything lined up.
What's interesting is my brain goes into things like cars, and I've heard Lexus is a really well-built car, and that's one of the things that I hear is just very smooth. So in other words, they've gone in and they've created that right setting,
foundation,
and then when they put the veneers on afterwards, your teeth are able to stay looking beautiful for a much longer time period. And I know that you guys even your work lasts usually the rest of their life or a long, long time.
We can't make that promise because we don't know what you guys are doing to our dentistry out in the real world. But it certainly has a better prognosis. That's our big term for how, what we think, what we predict of lasting if the alignment is correct before the porcelain is added.
Any other stories of people that have been using, they got in, they did Invisalign, and what changed in their life?
One of the other considerations when you're looking at how proper alignment improves the smile and the health of the patient has to do with gum and bone issues. If you've been told you have periodontal issues, gum and bone disease, any bone loss, and you have crowded teeth, you have more nooks and crannies to try and take care of. If you have a tendency towards any kind of gum disease, straightening things up, gaining good access to be able to clean without nooks and crannies improves gum and bone health.
It just reminds me of the last time I was in there and they were cleaning things and they found a little pocket and they're like, you saving something for later? I'm like, not intentionally.
That's exactly what we call it, pockets too.
Yeah, yeah. So, I look at the way that it changes lives, and I think that's one of the biggest things when you're really talking about the idea. Anything else that you'd want to say about life-changing?
Life-changing, one story, young man. He had braces as a teenager, but he continued to grow, and with the growth he had spaces in between his teeth. Spaces in between your teeth is a bit of a juvenile look. And he was at a point in his career where he needed to look grown up. And Invisalign closed the spaces and it matured his smile appropriate to his age and position.
Outstanding. I know we've got another break coming up here, and you're listening to or you're watching Smiles by Mary. This is Pat Dewar. We'll be right back.
Staying involved in dentistry on every level, local, state, and national, makes me a better dentist. Our patients are our life and our livelihood, and we appreciate every single patient that walks in that door. And these are our family, and we treat them that way.
And welcome back to Smiles by Mary. I'm Pat Dewar. The host of the show is Dr. Mary Swift. She's the 2011, 2012, 2013 Consumer Choice Award winner, and most recently nominated by Angie's List with the Super Service Award. So we're talking about Invisalign. We're talking about what it's done for people in clients of yours. I'd love to know, are there any other benefits that you see in doing Invisalign?
One that we haven't talked about yet is something that in dentistry it's very current and timely to be looking at airways.
Looking at airways.
Okay, follow me on this. The size of the air passage that you have is important during sleep, okay? We want to get as much air as we can. You've probably know somebody that's on a CPAP or a snore guard or some appliance to help them breathe better at night when you sleep.
My wife just wants to stuff a sock in my face, but
think about this. With Invisalign, we can open up airways.
Oh, really?
Literally, if you have a constricted arch, a narrow-shaped, horseshoe-shaped arch, and we can expand that arch, we can get you more air at night.
Oh, so what you're saying is actually in the U of
in the back
this,
of the throat's expanding,
and you're using
getting more
Invisalign to do
volume
that?
for air. Yes.
How are they doing that? I mean, I'm really curious.
Expanding the arch, opening up the arch, which opens up the available airspace. So that's just one example of improving your overall health with Invisalign to open up an airway. Alignment is important for spine health. TMJ, some patients, you might have heard of TMJ. It has to do with this jaw joint. And some patients suffer horribly with TMJ. It's actually TMD, the dysfunction of that joint. And that happens because of missing teeth, misaligned teeth, and you can correct that with Invisalign. You can get better alignment, which gets that joint healthy, which helps with migraine sufferers, clenchers and grinders. We talked about airway. We talked about gum and bone disease. Improving your overall health.
I'm amazed because I know that even my wife had, they literally went in and broke that at one point and reset it. And I wonder if Invisalign could have been one of those things. They didn't have it back then, but you wonder if that could be helpful.
You wonder. Invisalign has been around for about 15, maybe even 20 years now, and was originally designed for just simple issues, simple crowding or closing spaces. It's gotten much more advanced with research and development and product development. So it started out simple, but it's now a very important part of my practice, that's for sure.
So these little trays, they're going for, you said 2 weeks, so they're coming back quite frequently, or what do you do?
Thank you for bringing that up, Patrick. No, we monitor each case about every 6 weeks. We give the patient 3 trays. And they wear each tray for 2 weeks. They come back in. When I start an Invisalign case, I have the finished product on the computer. In other words, I straighten the patient's teeth digitally on the computer and set a button when I see what I like, and then I monitor the case and make sure the computer and the patient are following along and things are progressing the way they should. So we give the trays out every 3 or 4 at a time.
Really? Now, one of the other things is the importance of the standard that you use. I understand there's a dimensionality that you're trying to reach for.
Well, we're one of the few practices in North Texas that digitally scans the patient's mouth as opposed to taking an impression. You've all been at the dentist and had them, fill a tray with a putty and put it in your mouth and, time it, and we no longer. We have a digital scanner that makes a computer image, which is way more accurate than the impressions, and so the outcome it's a better outcome, better fit trays, more predictable outcome for the patient.
Then isn't there some sort of, I don't know if it's called a Da Vinci type of standard that you've used for actually aligning and creating the perfect smile?
When we're talking about teeth, yes, and porcelain and improving an aesthetic smile, there are dimensional rules by far. You literally look at the patient's face, divide it into thirds, you look equally. Our eye likes symmetry, and so every aspect of improving a patient's smile has to do with how well it fits in their face. One of the biggest mistakes I see with some of the dentistry out there is it's a little disproportionate to the face, and somebody didn't consider all of those measurements.
Yeah.
You've seen it too?
Well, I'm sitting there thinking of things that look like chiclets in your mouth, and you're like, that doesn't look real good, but somebody persuaded
I love dentistry. It's a combination of science, art, math, beauty, all of that to put a perfect smile.
Well, and you're such an artist in what you do. And in one of the things that I know, and in order for you to have created what you've been able to create, it had to have been the standards that you've run and the systems that you use for the last several years. And Smiles by Mary is really kind of an educational tool for current clients and future clients. One of the things we want you to do is listen to these shows, learn about different applications that you might be able to use in your life. We've got one more segment coming up. Smiles by Mary. We'll be right back.
Staying involved in dentistry on every level, local, state, and national, makes me a better dentist. Our patients are our life and our livelihood, and we appreciate every single patient that walks in that door. And these are our family, and we treat them that way.
And welcome back to Smiles by Mary. I'm Pat Dewar. The host of the show is Dr. Mary Swift. Dr. Mary Swift, 2011, 12, and 13 Consumer Choice Award winner. I love saying that because she really has earned that title. One of the things that if you go to, and I encourage you to go to, Dallas Laser Dentistry, go to the DallasCosmetic Dentistus, the website.
Hopefully, yeah, there it is.
Connect, and then really go through the experience, because we're talking about Invisalign, invisible braces, and how it changes their life, and how they don't, they wear it for a season, but it's progressive. It's very quick, but not short. In other words, it's very efficient for what they do.
Yes.
It's not going to last.
Efficient is a good word to tag to Invisalign. I always say on traditional braces, those wires are on the outside of the arch, and so it's kind of like a gate swinging. But the Invisalign tray fits tongue side to cheek side, so it's a more efficient movement.
Well, I look at my own son, and he's still in braces. He's been in for like 3 or 4 years. I'm thinking that shouldn't take that long.
It should on kids. Yeah,
well, for him, I don't think it's that he's gone to the orthodontist enough to have them tightened, and that's why I look at these things and I go,
you have to be compliant with Invisalign also. If you don't wear the trays, it doesn't work. So there's that issue. One of
the secrets, do what your dentist says. Then you got to keep the teeth that you want.
We kind of know what we're doing.
Yeah.
Patrick, can I touch on something?
Please.
You were kind enough to mention our awards, our service awards, and I have truly one of the best teams in place in my practice, and I really would like to take just a second to acknowledge them. Those service awards, it's not just me,
Absolutely.
It's the whole team. When someone picks up the phone to call my office to schedule an appointment, we want that experience from that initial contact being nothing but wow all the way through. And I think our awards are saying we do.
Absolutely.
It's what we
Having been there and experienced it, I'll just say outright, every experience from the first call all the way through to the experience of sitting in your office, that spa-like experience that you're just like relaxing, looking out over North Dallas, and wow.
I couldn't be more proud. I had a vision of what I wanted to create, and I live that vision every day because of the team that's in place.
When we talk about Invisalign, it is something that is, I want to say it's affordable, and a lot of people are employing it.
Let me tell you what makes it affordable. As we were talking earlier, I have people that come in that have invested money in the cosmetic improvement of their smile, and it's not working. Things are breaking, things are chipping, they're paying over. If that patient had done Invisalign to begin with, gotten things in a better alignment, a better position, more support for the work that's then put on, it would have saved them money. So that's where it gets affordable, because truly, if you're thinking about adding porcelain to your smile, if you don't think about support and alignment, you're going to have maintenance, costly maintenance on that porcelain investment.
When somebody uses Invisalign, they go through the process, they get their teeth aligned. Do they ever need to revisit that in any capacity later if I mean, does it happen?
Well, retainer, 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 retainer for the rest of your life.
Really?
Okay, have you ever seen a picture of someone when they were young? Okay, so you're visiting with, an elder, a 90, 80, 90, okay? And they show you a picture of when they were young and their teeth are perfect.
Right.
And then you look and you go, what? That's how we age. Everything drifts towards the center and then collapses where there's less bone. And so all those little lower front teeth just get all jumbled and crowded. If they're not touching each other correctly to begin with, it gets even worse quicker. That's how we age. So, getting yourself in proper alignment and then wearing a retainer, because whether you had braces or not, that's how we age. You'll have the youngest looking smile in the nursing home.
That's it. That's well, I believe that. One of the things that we want to encourage people to connect to you, visit the website, call, even if they just want to kind of check it out, right?
And we enjoy, it's a privilege to give a second opinion. What that means to me is that the patient's questions were not fully answered where they were, and they should not make a decision until those questions are fully answered, and I'll be happy to be the one to answer those questions.
So they just need to call, set an appointment, come in, literally just talk with you about
we'll
what they're
talk it
looking
out.
at.
Absolutely.
And the one thing that's really good too is that you guys really put together a plan that can work through over a few years.
Absolutely. And one of the nicest things about what I do, dentistry, is we almost always have options. You have a heart attack, the cardiac surgeon says you need surgery, you don't have any other choice. You're missing a tooth, I can give you 3 or 4 different ways to replace that missing tooth, to fit your budget, to fit your life, to fit your position. It's there.
I believe that. I know that you have story upon story. I know there's lots of testimonials on your website. There's lots of testimonials in just out on the internet about what you've done for them.
Read our reviews.
Yeah, the reviews just continue to stack up. But you guys have been open for how long now?
I have my 20-year dental school reunion this year. I graduated Baylor in '94, so I've been there for 20 years.
Outstanding. Folks, Smiles by Mary is really a service that Dr. Mary Swift is offering to the viewer. If you're watching this online or you're watching this on air, get to know Dr. Mary. She's worth the phone call, the visit, and the introduction, because she can really give you the right solution for your mouth in every way. Smiles by Mary. We'll see you next time.